financing. Dr. Cheryl Cashin is a health economist who has worked in lots of far-flung countries, specifically Albania, Georgia, working in Central Asia, and even California, working on health reform. So she has agreed to take questions throughout and actually said that she enjoys kind of an interactive back and forth seminar. So please feel free to raise your hand and pepper her with questions. And we'll try to save a couple minutes at the end as well.
Great. Thanks, Joe. I'm going to use the microphone just to make sure that my voice can be heard in the back. It's really a huge pleasure to be here for a lot of reasons. I graduated from the University of Washington, got my PhD in the economics department, so it's been quite some time since I've been here. And a very nice new addition to the scene is this institute. So it's really great to see just how large you are and great in addition to the global health community. What I want to share today is some experience that's coming out of the Joint Learning Network for Universal Health Coverage. And this experience, really, I'm just sharing on behalf of a very large group of people, so many, many people working in the network countries, the technical facilitators, partners, and Rockefeller Foundation funder. So this is just kind of the tip of a very, very large iceberg, but wanted to give you a bit of a flavor today for how this is working and what some of the experience has been. I think two of the most important aspects of this for me are what I consider huge foundational shifts in the 20-plus years that I've been working in health systems, global health systems. And one of those shifts has to do with health financing policy itself. I think 20 years ago, health financing policy meant how to get more money for the health system. So how to maybe increase user fees at that time, some microinsurance and social insurance systems, the Abuja target, 15% of health budgets committed to of government budgets committed to the health sector, but not that much strategic thinking. So in these 20 years, we've seen a lot of change in how we think about health financing policy. And universal health coverage, I would say, is the most recent iteration of that. But it's really a focus on objectives. So achieving some very clearly specified objectives for the health sector through health financing policy. The other part of the Joint Learning Network that is really, I think, very important in terms of a shift in thinking is how we work. So when I started working in this field, it was still very reminiscent of the early days of I would call it the post-World War II era thinking about development in general. That there were some answers and there were some infrastructure and things that were needed, and if you could just answer those questions, have the right knowledge, that you would develop. And I think this was very pervasive thinking in the health sector at that time, that there was a right way to do things, and if you just had that knowledge, your health system would develop. And I think we all saw that this was not working. And I like the term that Ellerman uses in the paper, it was unhelpful help. But this went on for a very long time, even though it was pretty clear that this wasn't a very helpful way to develop, it went on for a long time. And I think the Joint Learning Network really represents this shift that's been happening in the way of thinking about development in general, the way of thinking about health systems in particular. And that is that there is no one answer, there is no one destination. That countries are developing their health systems in an ongoing process. And I think nowhere is that clearer than in this country, that I would not consider this very far along the road in universal coverage. So it's a process, and it's a journey, and countries are at different points along the journey at different times, but there isn't this hierarchical view that really, every country has challenges at different points in time. So in 2010, a group of countries got together and decided that there was really a lot of experience within their own countries, in low and middle income countries, around the topic of universal health coverage, and they had a lot to learn from each other. And this real world experience, day-to-day challenges and how to solve them, that there needed to be a platform for the countries to come together and share that experience. And so they got together and founded the network and got funding from Rockefeller Foundation to come together in this network. The founding countries, Ghana, Indonesia, India, Philippines, Thailand, and Vietnam. And since then, more countries have been added, particularly in Africa. And these are all countries that are at some point along the way, but have made a commitment to reaching universal health coverage for their populations. So getting to universal access for health services with financial protection. And this is where the objectives of health financing policy come in, very clear objectives: access to services, financial protection, that no family should become impoverished because someone needed to use health services. These very clear principles, the countries have agreed to these principles in their own policies. The network has other principles, that all the countries have something to learn and all the countries have something to share. And that this peer-to-peer learning is a really effective method for solving some of the specific challenges that they're facing. And that this is all demand-driven. The countries have specific needs at a specific point in time, and they determine what support they get and when. So I think a very, very important shift in the way this kind of support is now being organized. And the other point with universal coverage, I think that these policy challenges are well discussed, and there's plenty of literature, plenty of analysis on the policy challenges, but not so much support and help around the technical challenges. The very day-to-day technical challenges. How do you develop a targeting system to target your subsidies to the poor, for example? Some very specific technical challenges. And this is where the countries wanted to focus. We get the big policy questions, but now help us to work on the implementation challenges. Let's help each other. So the network took that very practical approach, and the countries identified these technical areas that they wanted to organize around. And they identified provider payment, how to pay the healthcare providers for the services covered under universal coverage, health information systems, a huge technical challenge that they're all facing, expanding coverage, particularly to the informal sector. When you cannot reach people who are, if they're not formally employed, how do you bring them into the system? And improving quality. So these were the technical areas of focus that they found most of their challenges were lying. And then they also decided how they wanted to learn from each other. So how is this going to be different than how we've been working before? And they came up with a few different modalities that they thought this mix would get them access to the other country experience that they would find most useful. So on-demand learning and exchange, so one-on-one exchanges. So someone from the Philippines going to Thailand to learn about how their health information system is designed and worked. So very, very specific one-on-one exchanges. Some multilateral learning workshops, getting people together in a big group around a particular topic, sharing experiences and coming up with some creative solutions. Just finding a way to document the country experience in a way that's useful. And this is something that is turning out to be, I think, one of the biggest successful aspects of the network. I will spend a little bit more time talking about that. And just some support for operational research that's much more practical and reflects real-world country experience, and then some online resources. So this has come together in quite a complicated web of activities across the network. And what I've been working on specifically is in the provider payment area, working with the countries to synthesize experience around costing of health services for the universal coverage programs and coming up with the most helpful way to pay providers so they can manage within their limited resources. All right, since I said I'd be interactive, can I stop here and ask if anyone has any questions? Yes?
In terms of the learning mechanisms, is there independent evaluation of, say, like how each country is doing? Or how is it self-evaluation?
Yeah, so there are a couple of what we're calling kind of diagnostic tools. So there's a dashboard of indicators that the countries can use to self-assess where they are in coverage. So it's very much self-assessment oriented, although I think I would have to say we're at very early stages of that. The Provider Payment Diagnostic and Assessment Guide is meant for the countries themselves to look at where they are and whether or not their systems are working for them to achieve their objectives. But there hasn't been any, I think, larger scale self-evaluation. Yes?
What's the budget been for this project?
Well, so there was seed funding for the organization and management of the network, and then each of the technical tracks had a seed grant from Rockefeller Foundation. So it's probably in the realm of $5 million, I'm guessing, but please don't quote me on that. But there's definitely some different funding flows. So the Joint Learning Fund is a flexible pot that's managed by Access Health in India, where the countries can write proposals and ask to tap into that pot. So it's kind of spread around in different ways. So, yes.
Like among the four areas, I think it's equity. So where equity fit in this
Equity. So that's a really, really important question. The question is how does equity fit into all this? And I think what maybe you'll see is they try to, all the countries are trying to achieve similar outcomes. Okay? So their objectives are to improve health, to improve access, and to improve equity. So that's the fundamental objective that they all agree on. So what the network is focusing on are the operational steps to get there. Okay? And so all of these, if they're done well, should help achieve those objectives. That's the underlying, I think, principle.
What types of outcomes are considered in terms of improving quality?
That's a really good question, and the countries themselves are determining that. And I think that that's been one of the biggest challenges in the network is getting their arms around such a big topic like quality, and what does it mean? And it's very context specific, in fact. And that I think is one of the first steps, just having a process to go through that and defining in this country, in this context, what do we want to achieve. Yes.
I was wondering if you could say something about how the countries were selected. There's some interesting geographical
Yes.
gaps.
Uh-huh.
I think South America.
Mhm.
And a lot of Central Asia, Europe. I was just wondering, how that all happened.
Yeah, the countries self-selected is the short answer to that. And these are the countries that were, it was kind of spontaneous in a sense that they were at a meeting discussing challenges, and these were the countries who were around the table and said, we would really like to see this happen. And the way the network is expanding is really at a turning point right now. And I think that there's these countries that have a steering group that they're really making decisions about how the network will expand. But the not having the Latin American countries in the network, of course, is a noticeable gap, although they have served a lot as resource countries for different experience. So I'm going to focus now, kind of drill down on these areas just to give you a flavor of how this is working and what I think is a bit different about the approach. So just to also show you some of the learning modalities in action. It's a very dynamic way of working, and there's just a lot of interest and excitement. This group in the corner has come together now 4 times over 2 years. It's the same group working together on a very narrowly defined topic of costing for health services. Others have also participated in an ongoing way. So the point I wanted to highlight for this particular group today is that this kind of working across the countries has also generated what I would consider a different kind of policy research. So we now have a few examples of policy, very specific policy research that has been carried out using tools and products generated by the countries themselves and synthesizing their experience. And so they've produced together analytical guides that help get at what they consider more practical questions and get more down to the nitty-gritty of what are the challenges that they're really facing and how do you do research that captures that. And so we have a couple of examples of co-produced analytical guides that are now being used for, I would call, more practical policy research. And it's timely and it answers their pressing questions on a technical level. And the other byproduct of this is that we're finding that it also helps the countries have a common language about some of the technical areas that helps them share experience. So the way they use the term capitation, for example, in one country is very different from another country. And some of this helps to speak in a common language and share their experience a little bit more effectively. So then one question that came up, you asked the question, why those countries and why those topic areas would be another question. Why did the countries settle on some of those technical areas? And what we've heard over and over from the countries is that the way that they're paying providers now is not getting the most value for money in their systems, and it's not helping them to balance their expenditures with their resources, and it's not creating the right incentives to, for example, get resources to primary care. So they found this as a really important entry point to make their universal coverage systems more effective. So taking provider payments as an example of how all this works, the first time the countries got together, they all said basically, we just need to know what's the payment rate, what do we need to pay for these services, how much should I pay the hospital for this discharge, or how much should this outpatient visit? And wanted this answer, what is the right payment system, why should we use DRGs? And they had these questions that were very specific. And they kind of stepped back and said, actually, what's really important is the process to get there. And that was something that came out of sharing the country experience, that to get the process right, to go through the process of understanding your current situation and getting everyone around the table to come up with the solutions was much more time consuming, but actually had a lot more benefits to the system. So what several of the countries have gone through, and this has been in Ghana and Vietnam in particular, they found that the way that they were paying their hospitals and doctors was depleting their systems. So they had open-ended fee-for-service. The insurance was just getting claim after claim after claim, and they were paying them, and both Ghana and Vietnam were at a crisis point in their systems. They weren't going to be able to continue to expand coverage within their limited resources. So they got a process, sat around the table, like what do we need to do about this? What are our objectives? And being very clear about specifying their objectives. And that's where we were able to come in with some of these joint learning products that other countries have contributed to, and said, well, to do this right, you need to get everyone around the table, identify your objectives, and then you need to see what's working well and go through a more systematic process. So both in Ghana and Vietnam, they did this, the diagnostics. And they went around and really tried to understand what the real problems were, rather than taking a solution off the shelf, which has been happening quite regularly in a lot of the other countries. And then trying to step-by-step design the system more strategically. And so the boxes in red are sort of where the joint learning network products have fed into this process in these countries. And using these guides and using the collaborative model that I'll talk about in a minute to work through this process in their own countries, to come up with a solution that's appropriate, but then to pay that forward and share that experience with the other countries. So it's kind of a nice cycle. So this is what when the countries came together and said what they needed to know in order to make better decisions about paying their healthcare providers under universal coverage. And they said, first of all, we need to be very clear about what our objectives are, what is our context, how are we different from other countries, how are our current systems working, and how do they compare to international best practices, international definitions. And then, are they really helping us to get to our objectives? Are our current systems getting us to our objectives or not? And then what are the options going forward? And so the guide is structured to ask these very practical questions and to walk through the whole process, to interview stakeholders and to work with them to get at the answers to some of these questions. And this is just a little sample of what it looks like, just a kind of a structured interview guide that asks very, very practical and simple questions about where the current system is, whether or not it's contributing to objectives, and what needs to be changed. The other technical area that they've asked to work together on, as I mentioned, was costing. So they don't really have the information in their hands necessarily to figure out how much to pay for a hospital admission, for example. And so the countries got together, and as I said, they formed this group. They have met now 4 times over 2 years, and each time are contributing their experience, contributing their tools and templates, and have developed a manual for other countries to use to go through this process, to develop some sort of costing basis for paying providers that kind of recognizes the real challenges, that most of the data won't be in computerized format. What do you do when you have private sector providers who have no interest in sharing their cost information with you? Some very practical, real-world challenges, and what have these countries done? What are some of the creative solutions that they can suggest and synthesize all of this in a manual? So some of the practical recommendations that came out of this work, so soon after the costing work is commissioned, the costing team should identify and prioritize stakeholders. So I've never read a technical manual that tells you that you should get out there and get your stakeholders around the table, or that you should adopt the least expensive and least labor-intensive approach that is still valid. So the advice that's coming out is very practical. It's not necessarily the most rigorous research, but it will get them practical answers to their challenges right away. And this is the group that's been meeting periodically, and the manual is almost finished. So the recent experience in Vietnam is where all of these pieces have come together and really come to life, I think, with the most concrete experience. And that's where there was a policy window open. And so they really were able to take advantage of the network and to test out some of these approaches and products. Before I talk about Vietnam, are there any questions or comments up to this point?
One question. One of the previous slides mentioned an impact analysis. So wondering if that's country funded or if there's independent funding for that.
So what the countries who have undertaken this have all written applications for funding to carry it out. So in Vietnam, they got a $30,000 grant from the World Bank to do it. In Mongolia, they got a grant from WHO. So the countries have organized it, have written the grant proposal, and been funded externally. So, any other questions? So the policy imperative in Vietnam was actually quite a dire situation. So about a year and a half ago, Vietnam had previously taken a step to try to manage costs in their universal coverage system by paying district hospitals a capitated rate. The district hospitals got paid a certain amount per person per year to manage all of the care. So all of their primary care, all of the hospital admissions at the district hospital level, and also all of the referrals. So if someone bypassed the district hospital and went to a higher level, the district hospital had to pay out of their pocket. And that was the Social Security, Vietnam's purchaser for universal coverage, their way of trying to manage the costs in the system. But as you can imagine, it put a huge amount of risk on the district system. The district hospitals were going bankrupt in some cases, really, really not able to manage this risk. And so there was a clear decision in March of 2012 that something had to be done to save the system. And they wanted to they said, do it right this time. Last time they took an idea off the shelf, capitation, fund holding, and they implemented it, and it was a disaster in some sense. And so they wanted to go through a process a bit more systematically this time and try to get at a decision, a set of payment systems that would help meet their objectives. One of the clearly stated objectives in Vietnam is to strengthen the grassroots level of care, so that capitation system was having the opposite effect. So they went through this entire process from March of 2012 until just this past month, and very carefully got stakeholders together around the table, tried to hear what was wrong. They brought in some international representatives in one of the workshops to hear how are other countries using capitation. They invited Estonia. This was all under the umbrella of the JLN, and to hear what are we doing that's different from international best practices. They then spent another few months carrying out some of these research studies based on the products from other countries. So they did a provider payment assessment based on the guide. They did a costing study based on the costing manual to bring some more evidence into the process. Had another consultative workshop this past September to look at the results of all of these analyses and to make some proposals for reform. And they do have now a pilot that's proposed to fix some of the problems in the system and to use provider payment a bit more strategically to meet their objectives. What they found when they actually went out and talked to people in the field, talking to the hospitals, asking these very practical questions that were suggested in the guide, is that they had some things that were working well, but there were huge trade-offs. And actually, none of their objectives were being met. There were some really shocking, I think, statements that were coming out of some of the interviews that really shed light on the depth of the problems at the district level, which having this systematic structured guide that was validated with a group of peers gave a lot of weight to the results of the analysis in the policy process. So they found that although the budget was supposed to cover much of the expenditures, particularly at the primary care level, it was only covering about 60%. And they were having to, of course, charge people out of pocket for the remainder. So there are a lot of problems. That was going against their objective of improving financial protection. they found that the incentives in the system were just not at all working in the way that they had originally planned. So the results of this assessment then were shared with the Mongolian colleagues as they planned their provider payment assessment. And one of the Vietnamese researchers actually shared their experience by a video broadcast as the Mongolian team was getting ready to start their own assessment. So kind of using the network resources, but then paying it forward to the next country is an important part of this work. So yes?
So in terms of the research studies, basically it's about literature review work, right? Or systematic literature review. Do they collect their own data to conduct this kind of research study?
Yeah, so the idea is that the guide itself reflects the synthesized experience of the other countries, so that the key questions that other countries have found useful to ask and how to ask it, and some of the really practical challenges that aren't obvious sometimes to researchers. So that was in the guide, but the actual data came from their own stakeholder interviews and analysis of some secondary data. Is that clear? Yeah. Any other questions or comments on this? So the Vietnamese team also used the costing manual that the researchers had been participating in the collaborative for 2 years, and they were able to use the tools and the advice in the manual to do their own costing study. They found, for the first time ever, really, a costing of primary care services in Vietnam. They didn't have this information before. They found that pretty much their unit cost per visit at the primary care level was about $2, but very large variation geographically, which is not a surprise. So in the mountainous areas, it cost quite a bit more. But the part paid by insurance was really only covering about half. But if they looked more deeply, what was actually being spent, that the government was really only covering less than 20% of actual costs of the primary care level. So again, the objectives of the country to strengthen primary care, to build the grassroots level of the system, that's not where the funding is going. And this was kind of a huge surprise for them as well, that they found out that really more than half of money was staying up at the provincial level, some more money was staying at the district hospital level, and very little was getting down to primary care. This is information that they hadn't had up until this point. Then they turned around and shared this experience, and is now being incorporated into the manual. What they found, some of the particular challenges that came up during their research has now been incorporated back into the practical guide. The policy impact was, I think, that all of these pieces together have been instrumental in the decision for the Ministry of Health to propose some pilots in 4 provinces to have a much more objectives-driven provider payment policy. And it's taking a combination of their research studies, the evidence that was brought to the table, looking also at the international experience and the experience participating in the joint learning activities. So they have very clearly stated objectives now, which they're designing their pilots around. So all of this has been really wonderful and very positive, a very positive development, I think, in the way of working, in the way that countries are accessing experience and evidence to bring into their processes. There are a lot of challenges, and a lot of very practical challenges. Getting countries to work together is, the obvious one is that every country is at a different stage and has different challenges that are highly context-specific. So finding the challenges that are common is really key in all of this. There are many, but of course every country is very different. And so trying to find a way to address challenges that resonate with all of them. There is a huge constraint on the supply side, if you will, to use an economist's term, that there is a wealth of experience and a lot of knowledge out there. The people who have it are very busy. And so to be able to get everyone in the room and sharing or using technology, it hasn't really been, those answers haven't all really been that obvious, how to bring the people with the experience together and to do it in a way that doesn't burden everyone's time, but is trying different ways to do that. A lot of language barriers, and I don't just mean conversational native language barriers, but technical language, and just having everyone use the same terminology to talk about the same things can be a challenge. And of course, it's difficult to measure the impact. You can feel it, you can see it, but can we measure it? It's not so clear. But just a few thoughts on this. I think that we're just getting some ideas about how this works. It's at a very early stage. I think some of the key lessons that are starting to emerge is that weaving some of the joint learning and the synthesized experience into the country processes and how to do that is really key to the success. So hitting on the right issues at the right time. Vietnam, the policy window opened and they had access to the network, the right inputs, and it was very useful to them. Okay, so weaving that together is a bit of a challenge, but I think absolutely necessary. And then making sure that there's a pay it forward aspect to this. So that experience then gets passed on. And I think there's still a lot of learning to do about how best to do that and how to make that experience accessible to the other countries when they need it, as they need it. It's really important that the policy research analysis is grounded in the real life questions. I think that all of the high level policy discussions are very interesting and the countries find that very interesting, but when it gets right down to it, they need to solve some very technical problems in their day-to-day work. And finding what those challenges are and getting the right way to help solve them has been key. And this dynamic process, I think, between the joint learning and the country activities, it's a way of mutual support that is very different from traditional technical assistance. And to me, that's the most exciting part of this. But there is still a role for technical facilitation. This is a process that, to be effective, has to be clearly structured and managed. And you need some group or individual responsible for doing the heavy lifting. So for synthesizing and writing and actually getting this out, communicating, and there's more and more of a role, I think, of some of the country institutions taking this over. But this is sort of the next phase. And hopefully we'll have helpful help across countries as a result. So I just wanted to share this early experience with you, and I'm really looking forward to the discussion that will follow. Thank you.
Two questions. First, who are your counterparts in the countries? You look for people for the ministries of health or some other research institutions. And the second one, also linked to this one, is what is the response of the ministries of health in terms of implementing these pilots and these changes?
Mm-hmm.
How you deal with all the rotation of personnel they may have? How do you do to move forward after you get something there?
Yeah, no, these are really great questions. I think that the engagement in the network happens at multiple levels. So the network participation is at the country level. So the key institutions in the country. So the Ministry of Health, the Health Insurance Agency, if there is one. So at that level, and they're more engaged, I would say, at the steering group level and sort of the big picture level. But then a lot of the work happens, the counterparts are at the very technical level. So technical departments in the ministries are they're the ones sending representatives to the meetings. In the pictures, the people sitting around the table for the costing collaborative, they might be in a technical department. For example, at PhilHealth, he's now actually Vice President for Corporate Communications, so a higher level. We have some university researchers, so it really varies, but typically it's at the technical level. And then your other question about bringing this back into the process, that is completely, it has to be at the initiation of the country. So Vietnam approached the network and said, we have this policy imperative, we have to revise our provider payment policy, we want to get support from the network in this process. So it really came from them, and then work out how that support can be most useful and what other complementary measures, sources of funding, et cetera, are needed. So, thank you.
How do you plan to involve more countries in the project? I guess these are the countries who have the highest political willingness to change.
Well, this is really a question for the steering group of the network, and that's mostly made up of the country representative. And I think this is it's a really burning question right now, wanting to expand the network, but also not wanting to spread too thin so that it's completely not able to generate impact. So this is a question for them. The steering group is continuing to meet, and I think they'll make that decision. But it's up to the countries, really.
Could you imagine to have more groups, to group countries in smaller groups? It would be easier to manage, maybe? Or
This is yeah. I think it's definitely one of the suggestions that has come up, that maybe regional networks would be effective as well. I think it happens some ways just naturally. The countries that are getting together and asking to share experience tend to maybe be from the same region. I think that's certainly one of the options being explored, and you could argue it both ways, I think. There's a richness from seeing countries in the room from different regions and seeing that they face similar challenges, although the contexts are very different, but then they end up talking to people that are their neighbors. So, yes.
I couldn't agree more with you in that it is really tough to measure the impact or demonstrate the impact, but it seems as if it would be a pretty important component, especially if you're trying to differentiate this as a more helpful help than previous efforts that are of unhelpful help. So I was wondering if you could speak to, even some of the process indicators, or especially as you're trying to make the argument as to why other countries should be involved or why these countries should remain involved. How are you going to show that this is something that's better or working or it's helpful?
Yeah, and at first, just to be clear, I think that there's a whole continuum and a whole range of ways of working that are helpful. So this is just one. I'm not saying this is the only one. It kind of presented it as a dichotomy, but there are many, many other ways. This is the other extreme to me of the very top-down approach that was very common when I started working in this field. The question about measurement, it's something that the network has been grappling with from the very beginning, and it's the formative evaluation, how do we know what's working well and what needs to be changed, or just the bigger question, is this a better way to do things? And I think there have been a lot of attempts to come up with some sort of process measures, and I think it's just a work in progress. And I'm not sure that we have a framework even to work from. And I know a lot of people are spending a lot of time thinking about this, and frankly, funders want to see. They want to see what the results are. So I think I'm not sure I have a good answer for you, except that it's something that everyone recognizes needs to be done.
How do you organize the discussion about package services, especially when thinking about expanding coverage? It's actually a question for
I'm sorry, I'm not sure
How do you organize the discussion about package services, especially when thinking about expanding coverage?
That's a really big question. I think that's a really very big policy question and technical question, actually. And this is not an area that I have been working on directly, although it's related. And I think one of the two things are coming out of the discussions. And one is that most of the countries who are committed to universal health coverage have committed to fairly comprehensive benefits. That reducing benefits is not the way to get to the goal. And so they have committed to a fairly comprehensive set. And now they're figuring out how to pay for it. And so provider payment and using resources most effectively is one way. Another option that's being discussed is more at the margins, but for higher cost services and drugs, doing some sort of health technology assessment and having some criteria to prioritize. So I would say those are the two major thrusts, but really the question is more how to pay for what they would consider a minimum comprehensive benefits package. Thank you.
Could you see the implementation of this model across various other developmental goals for different countries? Because I think it's really true that most development is kind of top down, like knowledge down to people who are ignorant according to the model. So could you see this expanding into sort of other processes in development?
I think it would be a great thing, and I think there are just some principles that apply to any topic, and I think every area of development has big policy questions and big policy issues, but then some very specific technical challenges. And I think there's a role for joint learning in both, but I think the idea and the principles and the approach I could see applying to almost any area of development.
Two questions. Who specifically provides technical assistance? And secondly, recipient countries will many times receive funds from many sources. And is there any discussion about management of these different sources and extensive reporting requirements required?
Yeah. So who provides the technical assistance is again, it's very specific to the country and the issue. So in Vietnam, when they were looking at their main challenge of changing directions with provider payment, they requested to have support from a couple of countries that they thought had models that might be useful for them. So they asked to have experts from Thailand and Estonia sit around the table at different points in the process. They also asked for other people known to be experts in the field who had had experience in a number of countries. So that was really what they thought would be most useful for them. And it's different for different countries and different challenges, but it's driven by where the country thinks they can get the most value and what experience they would like to learn from. The second question was funding sources. I think that's one of the roles of the coordination of the network, and that is helping to match resources, countries with resources. So in the process in Vietnam, we sort of laid out what they wanted to do, and then our organization helped them match to resources. And so they were able to tap into the World Bank, they were able to tap into some other sources of funding. And the different reporting requirements, I think that is just a challenge of this sort of funding, and I'm not sure there's an answer to that, except having an umbrella, having a clear proposal, having some sort of articulated demand, it at least helps to get the funding and may also help guide the reporting. Yes?
Towards the beginning of your talk, you talked about countries doing the self-assessment of the universal health coverage where they are. Can you talk a little bit more about the indicators that they use to self-assess?
Well, there's a dashboard that was generated, and it has been kind of vetted through consultative process with the countries, and I honestly am not sure where that stands today, but we can certainly put you in touch with people who do. And I think it's one of those, it's in the process now of validation. Yeah, I think I have to be very honest and say that the impact evaluation is really at an infancy stage, and all of us have this kind of at very high on the priority list of things to do, and just now getting a feel for what those impacts may be. And I can give you an example. So the Costing Collaborative Group, who has met under the organization of the network now for 4 times, at the last meeting spontaneously got together and planned their next meeting without external support, without external funding. So some measures of sustainability might be hidden in there. And so we're trying to look at where these areas of impact are popping up and how they might be measured. And hopefully, it's not the way that you would do it ideally, or you have a framework, kind of the logical framework and your activities leading to these outcomes and these measures. But I think we're trying to, it's a new approach. So a new approach at impact evaluation is probably also required. Sorry, I don't have a satisfactory answer on this really important question and point. Yes.
I'm wondering if you could comment on the various modes you use for making network countries familiar with the international best practices, for example, in provider payment reform, and is there any one approach that seems to be most effective?
I would say that the biggest message that is coming out of the work is that there's no one system that's better than others. And so the international best practices is really having a process. And that's what I think is synthesized in the assessment guide, that comes from all the different experiences, and that there isn't one answer, there isn't one best approach, but the best practice is to go through the process, to do the diagnosis. What problems are you trying to solve? And then choosing payment systems that are more likely to help solve those problems, that are more likely to help you achieve your objectives. So I think that was the main best practice that has come out of this work on provider payment.
So then who is actually conveying that information to the network, or to a country representative? Is it a researcher like you, or is it somebody from a country that has had success with provider payment before? I'm just curious about the actual interaction.
Yeah, and again, I think this goes back to what the country demand is. So when they say that we want to make this change and we want to know what has worked well in other countries, we want to know what international best practices are. So that's when trying to link up to resources is our role as facilitators. And so to linking up with materials and linking up with experts and linking up with practitioners in other countries who have what would be considered successful experience. And so it's kind of a brokering, I suppose, arrangement, but that is the role of the facilitators in the technical areas. Yes.
So the belief that development is all about technology, I'm guessing that probably came from like the solo growth model, where, you know what I mean?
Yeah.
So it was all about technology or knowledge, right? So
Mhm.
for 50 years people tried this, it didn't work. And it suggests in the real world, the model that we should be thinking about is probably more like a Douglas North, Norman Roselle type thing, right? And if that's true, then it's all about the institutional arrangements, and therefore I can't necessarily learn from everybody. I can only
Right.
people that have similar institutional arrangements to me. So among your 15 countries, can you group them and say, gee, the Ghanaians really connect with these guys, but don't connect with these other guys? Does that make sense?
It does make sense, and I think that what we're seeing is, in fact, it's not even which countries connect better with which other countries who have similar institutions. It comes down even to the problem level. So for this particular problem, some country may have a more similar situation than us, than other countries, and so it's finding for their particular technical problems where they see experience that is most relevant. And I think that this idea of, there is some, I think, looking to specific models, and a lot of for example, Vietnam and the Asian countries are looking to Thailand as a country that has a model that they think would work well in their system because they have some similar institutional arrangements. But when you get down to the specific problem level, they find that maybe it's actually not so relevant on very specific issues, and they have to look to other countries. So I think it's a more flexible approach than that. And the one comment that we've heard over and over again is what they are looking to more than anything are processes. So where are processes effective, and where are the countries managing a process that they might get to a completely different answer with completely different institutional constraints, but they've managed to get together, bring stakeholders together, bring in evidence, and how has that worked in different institutional arrangements.
So you say that Thailand has been kind of a model for kind of successful solutions to some of the problems. I was just wondering, are there other country examples? And of course it varies by what problem you're addressing. But I was curious, if everyone's looking at Thailand as this kind of beacon of solutions, how applicable is that to, to the Ghana, to the Nigerias, that not only are grappling with very different disease burdens, but just, the way that people may access health systems or even view health seeking behavior. So I was curious if you could say if there were any other countries that, are looked to as examples.
Well, I think you hit on something that I would consider a success of this work. And I think when people first sat in the room together, they were looking for beacons. They were looking for the model that was going to give them the answers. They were looking for the payment system that was, that they were looking for these beacons. And after 2 years of working together, everyone has realized that there's nothing, that once you actually dig down into these, that there are a lot of things that are applicable to you or that aren't, and that you have to be a very discerning consumer of other country experience. And so that really has come through in the last 2 years of working. And so I think, again, it's breaking some of this down into the functions and the problems rather than trying to find a comparable context for the model that you might adopt. And breaking this down into some of the specific challenges that you can work through. You have to have your own homegrown model, and that's something that also comes up quite a lot. But you might be able to look to Ghana. They've maybe solved this issue of claims processing, or another country. Vietnam has done exceptionally well in targeting the poor for their subsidies for their insurance system. So looking at some of these specifics rather than finding a match as a whole. Is that answer?
Yeah, it's just interesting to think, taking bits and pieces, you should, tailor to what your needs are, but you also don't know how putting those pieces together are actually how successful they will be because you're creating your own approach. So just...
Yeah, and that's the process. No, I think that's the process that they're going through, and to at least know what the objectives are, be very clear about your system architecture and constraints, and then trying to put together the right functional pieces. So I think there's been a lot of failure of adopting a model, wholesale into whatever, even a very similar context. And I think that's something that has really come out of these last 2 years of work, that's no longer what they're looking for.
You mentioned that there is a little bit of consideration of past programs done. I was wondering if there are specific programs, perhaps say like different geographical regions, currently covered in the network. So the one that comes to mind for me is like PlanetSat.
Mm-hmm. So I guess right now where the network stands today, so there are definitely countries who are member countries who are working together, making decisions about the network and the resources, but there's no limit on the countries that are being accessed as resource countries. And so any model out there that is interesting, that they want to look at different aspects of, or different successes or experience, that's certainly open to the network to explore. But in terms of making decisions about resources, it's limited to the member countries.
Great. Why don't we thank our seminar speaker, and if you have a pressing question, feel free to approach your seminar.
Thank you.